Hi, this is Dr. Pepe, two 5-minute videos covering the NCE table of contents, and the first domain deals with professional practice and ethics. So that domain is 12% of the NCE. And the first subcategory of this domain, which we'll cover in this video, is the assessment of the counselor's competencies to work with a specific client. So basically for me, this subcategory A is referring to the multicultural, counseling domain. And the first things that I think about when dealing with competencies of counselors is in the multicultural domain is cultural humility. And to me, referring to cultural humility, it's referring to does the counselor portray professionalism as well as humility in the scope of their practice. And what I mean by humility is, are they open to the learning process? Are they open to the growth process? Are they coming into supervision or a counseling session with a growth mindset? So to me, when I think of is a counselor competent, one of the first things that I look at is their culture, humility, and how that plays into their attitude, as well as their perceptions and their professionalism. The other thing is the intersectionality. So when I am looking at a counselor's competencies, I want to know how they are looking at different domains, whether it's race, socioeconomic factors, spirituality, gender, geographic, language. All those factors have to be considered for a counselor to have that competency knowledge, especially if a client is presenting certain things and they might be perceiving it in a cultural lens. Well, as a competent counselor, one has to look at how that culture ties in with whether it's their gender norms, whether it's their religious, spiritual beliefs, whether it's their language. How is all that relating to one another? So for me, when the subcategory says to assess the competency to work with a specific client, both the culture, humility, as well as the intersectionality are the two things that stand out for me. And as far as this subsection, I would expect questions in relation to that. So I would consider, what are the culture humilities that a counselor brings that you would know that would be a competent counselor, or vice versa. What intersectionalities should a counselor consider in order for them to have that competency and be able to work with specific clients that may not look like you, may have different spiritualities, may have different gender identifications. How do you address your own personal biases in order to be that competent counselor, and not let those limiting beliefs or your own personal biases get in the way of a relationship that will ultimately help the client.